just thank you so much for inviting us. This is I was just mentioning, a nice way to start this is Thursday, right? Start my Thursday. So thank you so much for inviting us. Rachel and I and our team and the rest of our team, we're just kind of representing our group of 11, but we've all been really busy since March, really. Dr. Emily Valahanes and I at Western, we're both trained in public health. And so we really wanted to be contributing at this time when there's so many needs. And so we've partnered with Polk County Health Services to provide support, and also to get our students involved in a meaningful way so that we can help prevent the spread of COVID-19. And so I have some slides here that we can, just to get us started, I'll share with you all, just to share a little bit about what we've been up to. So what part can you see? The presentation part? Or
yes.
Okay.
Oh,
okay, good. You don't see the controls part here. Okay. So so our aims of our project really are, we started off really thinking about contact tracing. So we know that the local public health department is relatively small, right? And no one was thinking that we'd have a global pandemic on our hands. So we wanted to be able to provide contact tracing support to Polk County. So we reached out to them in early March, April, to start talking about how we could do this. And as we were speaking with them, it became clear that maybe they would also need some support with communication and outreach around COVID-19, particularly communication that focuses on some more vulnerable populations. And we were able to get funding from the Oregon Health Authority to do this work. And so we have been, right now we're kind of in the planning mode, but very soon hopefully you'll start seeing some of the products we're going to be putting out into the community to help with communication. And then also we're providing some real-time data to support contact tracing in COVID-19. You may be following, like on the Oregonian, they do put out information, and the OHA does have daily updates. We've been following that information and just compiling more information for Polk County specific to look at how things are going with trends in our area. This is our team. So like I said, Rachel and I are just two of a wonderful group of faculty and students, and we have students who are on their way graduating like Rachel, but we also have two project coordinators who are recent graduates from community health. All of our students are community health at the moment. And we are starting to, as students are graduating and moving on, we are recruiting new students to come in, and we are going to be working with the gerontology program at Western. So some of our new students joining us will be, gerontology majors and perhaps community health minors. And so this is where I'll turn it over. Rachel's going to talk about the next few slides.
Hello everyone. My name is Rachel Koljesky. I just this last weekend finished up my internship hours, so a very recent grad. But through my internship, we're going to talk to you kind of about my contact tracing. And so as a contact tracer for Polk County Health Services, our main goal is to interrupt the spread of COVID-19 within the community. So how we do that is usually the public health team at Polk County sends us the names, or they're called PUMs, but a person with COVID-19 identifies individuals that have been in close contact with them. So 15 minutes or more, with or without a mask or indoors. It kind of just, the way we put it up to the person who tests positive is, do you think that you exposed someone? And that's kind of how they get on our list. Once they're on our list, they're considered a PUM, so a person under monitoring. And so within the first 24 hours that we get that, we usually try to make a phone call out. When within the phone call, we ask certain things. And then after that, we ask their preferred method. So throughout their entire quarantine period, at least 10 days if they don't have symptoms, or if they live with an active case, it could be longer. So throughout whatever their quarantine period is, our main goal is to just provide support to stay home. And then as contact tracers, so in that very first phone call, privacy is one of the most important things. There are a lot of HIPAA laws, but this is a very scary time, and this is a very real thing. So privacy, scammers like to take advantage. So we like to make sure people understand what we will be asking and what we won't. Polk County Health Services and the WOU contact tracing team will never ask for your social security number, immigration status, credit card information, bank accounts, or billing information. That is something we'll never need for any reasons. We will ask what county you live in to make sure that Polk County, we have the right resources for you. So if I find out someone lives in Marion, we just transfer it over to Marion's team so they can take over and provide the correct resources. We'll ask your date of birth, your contact information, including the phone number, whatever phone number you prefer us to contact you through, a good email address that you check regularly, and a mailing address so we can send things like work notes if you need one for that, or we also send informational pamphlets that educate people on, how to stay safe at home and how to clean things and, proper mask wearing, things like that. We'll ask your occupation if you are working, and then whether you have symptoms of COVID-19 or not. And on the next slide is just kind of a breakdown of some of the symptoms. So cough, fever, chills, muscle pain, shortness of breath, or difficulty breathing and sore throat have been pretty popular ones. And very recently, there's been a new loss of taste or smell. And including in my calls, it's kind of been something that recently has been coming up that, people are like, I couldn't taste my morning coffee. And so, that's something to keep a lookout for. But it's also something to remember is that this virus is also, you can spread it asymptomatically, meaning that you have 0 of these symptoms, but you are still positive with COVID, and you could still be transferring it to people. So our main goal as contact tracers is to just inform people that they, may or may not have been exposed. Let them know that, with or without symptoms, COVID can appear within 2 to 14 days. And so it's just, giving people this, informed facts and helping them make an informed decision on how to stay safe at home. And then just assisting them through, whether that's grocery deliveries or if they have to be out of work for 3 weeks, making sure their employer gets a work note. Or even rental assistance. We've partnered up with Family and Community Outreach out in Dallas through Polk County, and they have been instrumental in getting people, rental assistance or even thermometers to people who might need them. So they've been a really amazing ally in this.
Great, thank you, Rachel. And so that's the one main service we're providing and working directly with Polk County Health Services. The other piece of our project that we're working on that we've received some funding from the state is to work on outreach and communication campaigns. And so our target audience in Polk County that we're working to get materials out to are older adults, low-income families and households with students who are in the public school systems, K through 12, the Latinx community, and then also WOU students. And so some of the messaging that we're working on is finding ways to deliver the message, not only, the basics about COVID, making sure people understand what is COVID-19 and how it's transmitted, understanding what is contact tracing so that if they do get a call, they understand why we're reaching out to them. We're also, one of the key messages is around maintaining that distance of 6 feet physical distance from others and wearing face coverings. And also, I think in our messaging is just getting out there, just like the prayer that was this morning that started off our meeting, was just that this is a new normal and that we all are having to make some changes in our lives in order to protect others. And so those are some of the key messages that we're getting out we will be getting out in a variety of channels and formats. We are working with our partners, and so we couldn't do this without other great organizations in the community. So we are working with other community-based organizations that serve the key audiences that we're focusing on for our outreach and engagement. We are working within the university. There's some great partnerships that are developing. We're working with our the Division of Education Leadership and the art department, which I'm really excited about. And then also gerontology that I mentioned, Polk County Health Services, and then also the state health department are working with us on this project. And then this last slide is just our contact information. So Dr. Emily Valahanes, you may see her on a future call for an update on how things are going and what we're doing. She couldn't be with us today. And then there's my contact information. I also, you may have noticed if you saw your email, I sent out to everybody on the email that was for the announcement for the Rotary Club meeting, a little fact sheet about our project. And so you can see all of the students that are working with us on our project, and has our contact information as well there. So I don't know if there's any questions for Rachel or for myself about the work we're doing.
I have a question. Do you provide any rent or mortgage payment assistance to people who are confined at home, quarantined for those 2 weeks, unable to work?
I'll let Rachel answer that one.
So it's not something that I do. We partnered up with Family and Community Outreach, and so as a contact tracer, what I would do is I usually ask people through either text or phone call, depending on how we're communicating. You know, do you have everything you need to stay home? You know, or if they're like, you know, if anyone even brings a concern to me, like, well, you know, I can't afford. I've had people who couldn't afford car payments, and FCO doesn't do car payments, but they'll do rental assistance. So it was, you know, kind of facilitating like, okay, well, is there any way that you could, you know, instead of paying your rent, because FCO can come in and subsidize that possibly, you know, it's kind of making those connections. But just as a contact tracer, we'll advocate on behalf of some of our POMs, so people under monitoring, and I'll reach out to the office for them. And then the office then has time to sit there and really look at what buckets they have, because there are a lot of funding too right now, and restrictions have been lifted on a lot of assistance programs because of the pandemic. So there's a lot of help for a lot of people that, in all honesty, is just sitting there. So I'll usually call FCO on behalf of them, give them the spiel of what to look for, and then they'll start looking at stuff. So by the time they call back my POM, they have a list of things and, you know, places to apply for assistance.
Thank you.
Yeah.
I potentially have a family member from out of the country coming into the USA. And if they have to quarantine for 2 weeks, what are the conditions of quarantine? Can they come to my house? Do they have to find a monk cell someplace? What is quarantining for 2 weeks? What does that mean?
So they're asking them to, if they're going to be staying at your house for those 14 weeks, they're asking that they go somewhere and they stay pretty much isolated from everyone, or, you know, just with the people that they've traveled with for those 14 days. So if they're going to be staying at your house, you know, making sure that they have a bathroom and a bedroom that no one else will be going into. And if they are coming out into communal spaces, even just to go to the bathroom, wearing a mask while inside and around others. But yeah, it's just trying to keep as much space. So if they are going to stay at your house, maybe even, you know, finding ways to, if you have a backyard, having, you know, a nice spaced out dinner with them. But yeah, it is trying to keep, you know, as much distance from you and them, and trying to contain that spread.
Okay, thank you.
Yeah, absolutely.
So I just wanted to say a quick word to the group, both for the benefit of the group, but also I think Megan is aware of this, having spoken with Chad at the city of Monmouth. But there is, as Rachel was saying, there's a lot of money available as well for things like utilities. And the city of Monmouth has a lot of funds with community action that are, as Rachel characterized it, just sitting there. So if you hear of people around town, either I'm assuming Independence has something similar, but essentially there should be very little financial hardship for helping with payment of bills, because things like utilities and rent and stuff, that money is available, and we've gotten quite a lot of money from the state or from the feds via the state through CARES Act. And so we also have funds for small businesses. I mean, virtually anything you hear about, please have them. If they aren't contacting, if it's not through a contact tracer option because they don't have the disease, have them contact their local city finance department and see what we can do for them.
That's wonderful, and I'll share that with our contact tracing team too. Thank you.
And just so everybody along those lines, just so everyone knows of this resource, there is a project called the Arches Project, and they're based out of the Mid-Valley Willamette Action Agency. But there is funding available there to assist with rental, with rent, and as well as utility billing, or bills and whatnot. So if just to kind of keep that in mind there, just I'll put it in the chat here just so you can look up on it. Just so you have, oh, I spelled it wrong, Arches. Yeah, just so you have that there, and yes, we do as well. To answer Janet's question, at the city, we do have some programs in place to assist our community members. And so, yeah, great suggestion for folks who do not have the link with a contact tracer, that they can still resort to contacting their local city officials. I have a question. So could you elaborate a little bit on the on pumps? Like, what does that, like the people under monitoring, like what does that process look like when someone is in that situation?
So when I'll get onto my national database, RAS, every day, and I'll look through my people under monitoring. And so when I first get a person, I have to perform an initial interview. So that's within 24 hours of them being put on my list. I give them a phone call, and that's pretty much me reaching out to let them know that they have been exposed to somebody who has tested positive with COVID-19. And then I start to kind of go through what quarantine means. This is all after, by the way, I verify their address and name, because I'm not just going to tell anybody that they have it or they've been exposed. But then we kind of just go through where I start asking, I ask a few demographics, so their phone number, where they live, what county they're in, just to make sure everything's good, and I fill out all my fields. And then from then I'll kind of just ask them pretty much, I'll let them know, we're asking you to quarantine till this date, depending on if they are living in the house with someone who tests positive, or if it was somebody that they just hung out with last Saturday and haven't seen since then. Their quarantine periods will be a little bit different. So I'll kind of let them know what it's looking like. And at that point, then I'll start to kind of go into, do you have everything you need to stay home? Do you have, are there any prescription needs that you have? If they're working, do you need a letter sent out to your employer? So we'll ask all those kind of questions. And then from that point on, it's just letting them know we'll be reaching out every single day to check in on signs and if they have any signs and symptoms, and kind of like a daily temperature check if they have a thermometer, which we will send to if they don't have one. And then from that point on, it's either a text, a phone call, or an email every single day to check in on them. Every couple of days, if they don't reach out to me on needing stuff, I'll just check in hey, how's it going? Are you, I know you're doing a little stir crazy, but have you had, have you and the family, 'cause I've had a lot of families on mine, have you and the family found a way to get out in the backyard and, relax or get some sunshine? So it's just kind of checking in then from there every day to see if any signs or symptoms develop, and just assist them if they, quarantine ends up extending a week and they didn't think that they would be in for, an entire month. So making sure, okay, well, let's get you that rental assistance then if that's what you need, or those kinds of things.
That's thank you for that rundown. Yeah, it's great to know. That's the picture.
Sorry, I have another question, if I may.
Absolutely.
So at what point and/or do you have the authority to recommend that somebody on one of your POMs gets a test? And what's the process for that? Like if you are seeing that they are developing symptoms, can you have them tested or ask them to be tested?
So for us interns, when we have a POM that starts developing symptoms, we actually send it off to the Polk County communicable disease team. And they get sent into a different database, and they start being monitored by the communicable disease team. So it's a little bit different. I'm sure that we do get them tested. When I have some of my contacts who are showing no symptoms, or or are just feeling a little nervous, ask me about it. We don't necessarily we tell people we don't necessarily recommend going to get a test unless you're showing symptoms. Just because even if you get a negative that day, doesn't mean that within those 3 days from when you took the test, you could then also, become positive. So it's not something that we necessarily recommend, but I'm also, when I tell people though, but if it's going to make you feel better and you can get in somewhere that will let you take a test, by all means, you can go get tested. But that's the thing though, a lot of places won't allow you to get tested unless you meet certain criteria. So, but I'm sure that, yeah, if they're showing symptoms and they're on our watch list, I'm sure that once we send them to the communicable disease team, they probably send them somewhere to get tested, like for sure.
Thank you.
Yeah.
Yeah, from what I understand is that it's still, if they have insurance, it's going through their primary care provider to get that testing. And if they don't have insurance, or if they can use, then it's they use the state system, and it's working through Polk County Health Services through their clinics to get the testing done. But that's the thing that's been really hard, is that delay. And now, even though it's longer than 3 days, people are waiting a week or more, and in that time they could have been exposed. So that's really been hard. That in an ideal world, in order for this to work the way it's intended, people would be getting their results within a day. And so that's why still that isolation is the best prevention we have right now, and the face coverings.
All right. Any other questions for our guests, folks?
I have a question. Are you finding most people are cooperative, or do they become antagonistic? How do people respond to this?
Well, so that's, I've heard horror stories, and I definitely, when I was asked to join the team, I did a little research, and I've seen a lot of people have been mean. I've had, honestly, some of the sweetest people. So for me, everyone's been really cooperative, and, they hear a young voice and they're like, I'm just happy you young kids are out here fighting the good fight. And I've had really good luck. Definitely I've had some people who were sick and tired of hearing from us at some point. And you can tell that they're over this whole thing, and especially being contacted daily. But no one's ever been really actually nasty or mean. So I've been pretty blessed to have some really kind people to contact daily.
Good.
Yeah, no, I was definitely worried about that too when I started, but it's been wonderful.
All right. Well, great question, Paul, and everybody else. I think, Bonnie, did you have your hand up?
Well, mine is more in the area of seeing certain clusters of people in businesses not wearing masks, sitting close, eating, drinking establishments, and flowing out into the parking lot. And I tried calling the health department yesterday, and was put on hold and then disconnected. And so it was one of those now whats. I know I can call them back, but is there any way? I'm very uncomfortable confronting this particular business personally. So I'm kind of stumped as to what to do.
I think, and Rachel might be able to speak to this, but I believe it's OSHA, the Office of the Occupational I'm sorry, I'm going blank at the moment, but
Should be anything else.
yeah, so
There
it's
was a business in Monmouth that was already given a warning about face masks on the 4th of July, and that came from OSHA. And so that's all I've heard. I am a resident here in Monmouth as well, and so I've seen some businesses, at the same, and I've kind of come into the same place too, where I've very much tried calling OSHA on, because I saw employers not wearing masks, but I just left a message. That's all I really got, so.
And I was looking to see, I think if we go on, I was going to see if I can find the link to put on the chat for you, Bonnie. I believe the Oregon Health Authority, they have a page just directly, I think it's Safe and Secure Oregon or something like that. And they have contact information for if you have, sorry, my computer has lots of, you can hear all those things. They have information that if you're concerned about the masks, then you can call OSHA. And like what Rachel did, just leave a message and let them know the time, the place, and then they should be following up with the businesses. Letting them know.
Hey, Bonnie, this is Chuck.
Hi, Chuck.
How are you today? Hey, if you have concerns and you're not comfortable discussing that with a business person, drop a name to me, and I would not have any problem going to them confidentially and saying, we're hearing these things. I would like to approach it as soon as we could, as opposed to waiting for some governmental agency to come back and deal with it the way they would have to. So if you're comfortable with that, just drop me an email or drop on over, and I'd be glad to go have a conversation.
Great. Let's start at lunchtime. Oh, it's still lunchtime. They'll still be out there.
Hey, Chuck, I saw a story out of Los Angeles where they were having some large party violations. The city was talking about cutting off water and power to that location. Is that something within your authority?
I would not want to do that. I want to promote businesses downtown, and I would have conversation with them saying that, hey, this is what we're hearing, and maybe you are or are not aware, and keep our businesses open. So let's find out what the response from the business owner might be before I jump to any other conclusions.
The businesses are in a bad spot also, because some people are being mean and refusing to wear masks and things, and it's putting them in a very bad place and their employees in a very bad place for confrontations.
Right, and I'm not the enforcer for all of that. All I'm saying is, through the Monmouth Business Association, we have a lot of friends downtown, and so I would just not fear going and contacting them and saying this is what we're hearing and making them aware. Then if they don't choose to do it, well, then the other consequences can come in.
That makes total sense. I really prefer the direct contact. I'm just so uncomfortable in this case. Thank you.
You're welcome.
Yeah, I have to really say I really do in like the community response, right? That this is a community effort, that we're all just watching out for one another. And I think that's where in public health, we see that that's a strength, that's an asset when communities can work together and mobilize resources and connections to meet the needs. That's just really empowering and beneficial. Using carrots and support rather than the stick can, really go along.
All right. Well, is there any last question before we wrap up our time? Okay. Well, I want to be able to give a supremely big thank you once again to Megan and Rachel. And normally in a normal gathering, what we would do is we wrap up the meeting by giving you all a book to sign, because one of the efforts that our local Rotary Club focuses on is literacy. And so we have these books that we are able to distribute throughout the community and elementary schools. But just kind of imagining yourselves just signing those books. And thank you very much for joining us. And also, like I mentioned, yeah, let's give a little round of applause. And of course, down the road, if you all want to join us, that link that you clicked to join today, it will be the same link until the end of the year. So so don't be strangers, and yeah, it'd be great to hear back. I know you mentioned that Emily might be able to join us sometime to kind of provide an update. But yeah, because obviously, you know, this sucker is still around, and so we got to be able to stay as informed as possible. And I feel very more informed today after you're all able to share what you shared.
Thank you for the invitation. It's great to meet you all, and yeah, I would love to join you again soon. Thank you.
I will add one more plug, Megan and Rachel. If you're at all interested, I can. If you, I think I'll have your email, Megan, if you responded to Ramon's email, but I can put you on our newsletter list, and then you can stay apprised of our activities and see if you are interested in coming more often.
That would be awesome. Thank you so much. Yes,
Okay.
I would love that.
All right.
You can also find it on our webpage, mirotaryclub.org.
And Facebook and Instagram. So we got that going on. All right. Well, thank you once again, folks, just for joining us. And then, of course, everyone else. Is that Susan? Is that Susan there? Hey, Susan. Good to see you. I put something on, there's something on the Polk itemizer today, and I was able to include your name on for the mask. So thank you very much once again for that effort.
You're most welcome.
Yeah. All right, folks. That's all for now. Join us next Thursday, 12 p.m. via Zoom.
Thank you, Ramon.
Bye. Bye.
Bye.
Take care, everyone.